Last Saturday, March 8th, I started with a cough and it was really hard for me to breathe. Overnight, I developed a fever. So the next day on Sunday, the 8th, I went to an urgent care where I was diagnosed with pneumonia. I felt worse throughout the day. I ended up going to an emergency room where I was diagnosed with an unspecified viral respiratory infection. I had a 102-degree fever. I couldn't breathe. I felt like I was suffocating in my own body. I was not able to get a test at the ER because I did not meet the requirements of traveling to a known COVID-19 area, nor did I come into contact with anybody known to be COVID-19 positive, which on March 8th, there wasn't a lot of us or anybody. The next day, I went to my primary care physician to seek some just pain relief and support. Breathing was very painful, and I couldn't get any answers about what I was diagnosed with. Since then, I've been calling my primary care physician. I've been calling different health resources, whether the state of Illinois, the city of Chicago, and I can't get anywhere. I'm not able to get a test to know whether I'm COVID-19 positive or not. I really would like a test for my own peace of mind and for my community, for those people who have come into contact with. I'm nervous about what's going to happen with our larger society with the amount of unknown, because we don't have the knowledge to be informed. That I'm nervous about how a lot of people in my age bracket aren't taking this seriously and going out and celebrating St. Patrick's Day or going out to the bars. And if I got this sick this easily, I can't imagine anybody who has any type of pre-existing condition, anybody who's not as fortunate as I am. I'm scared for them.
But if you don't mind, I'd love to get to some of the viewer questions because we have a lot of them and they are really excellent. Someone asked, and you alluded to this before, but someone asked, if there is a lack of testing, how will we ever know the real number of coronavirus infections?
That's exactly right. The viewer is exactly right. We just simply don't know. And it's very difficult. First, it's very difficult to be a patient who just wants to know if they have coronavirus because they want to know what's going on and will they spread it to family members. It's very frustrating to be the physician, the nurse, the clinician being asked about this when we know that our patients need this test. And it's very difficult to be a public health official, to be planning strategies when we don't know what the baseline is. And how can we even measure if our strategies are effective if we don't have the testing and the data to get us there?
This next question is a great one because this has been going around quite a bit this week about ibuprofen. Someone said, if you have coronavirus, should you skip taking ibuprofen?
There are very limited anecdotal reports coming out of Europe about ibuprofen as an anti-inflammatory and how it should be avoided for coronavirus. But there has not been a study that validates this. Okay. So I would say at the moment, listen to the recommendations of your doctor, and I would not start changing up your medications without speaking with your doctor first.
Someone was wondering, can you get the coronavirus and have the flu both at the same time?
In theory, yes. I think, though, that they're probably alluding to the fact that the symptoms of coronavirus could be similar to the flu. And patients with coronavirus tend to have high fever, cough, difficulty breathing, which are things that you might see for the flu also. Different than a cold, coronavirus patients tend to not be sneezing, drippy nose, and having all these cold-like symptoms. And patients with coronavirus could have body aches and atypical symptoms like abdominal pain, nausea, vomiting, diarrhea. But these are all non-specific, and there are many things that could cause these symptoms. And again, that underscores why testing is so important.
A viewer asks, why is coronavirus so much more contagious than the flu?
A couple of reasons. One is that it is a new disease, which means that none of us have been exposed to it before.
Okay.
And so none of us have immunity to it. We also do not have a vaccine in the way that we do for the flu. And that, again, is why the methods that we have now in terms of prevention and washing our hands, staying away from people, that's really the best method that we have to prevent from transmitting the illness.
What about patients who have other conditions? Someone asks, chemo, dialysis. You have to leave the house to get a lot of these treatments. How do we navigate that?
It is challenging because there are patients, there are people who have to leave their house and get medical care for a variety of reasons. I would say look at the conditions that you have and the trips that you have to take or don't have to take. Patients who need chemotherapy or dialysis clearly need to go to a whatever center they go to, whether it's a hospital or an outpatient center, to get that care. But patients who have regular appointments scheduled for a well person checkup, or to get their diabetes medications refilled, or their asthma inhalers refilled, perhaps that could be delayed, or many doctors have switched to telemedicine, and perhaps they can get those same medications refilled or their health checked up in another way. If you do have to go and go to your appointment, stay at least 6 feet away from others. Wash your hands very well. And again, try to limit your exposure to other people as much as possible.
Another reason, of course, you would be visiting a doctor, pregnancy. What advice can you share for expectant parents during this outbreak? I know I have a lot of friends who are expecting right now, and I think they're all a little bit nervous at this time.
I can definitely relate, and you can't see with the camera as it is now, but I'm actually 38 weeks pregnant myself.
Congratulations.
Thank you. So I understand.
So you're the perfect person to ask.
Right. So I think about this on a professional level, but also on a very deeply personal level too. So these studies about pregnant women just aren't there. There's one very limited case study of a case series of pregnant women from China. It doesn't appear that pregnant people have a higher risk of severe illness from coronavirus, but we just don't know. And pregnant women still are among those who are medically vulnerable because of changes to our immune system and our physiology. So I would urge for pregnant people to take all the precautions that we would recommend for others who are in that medically vulnerable category, and to really stay indoors, or when we're outdoors, to stay at least 6 feet away from others. I know we have a lot of medical appointments that we may need to go to, but it may be time to ask our OBs too about which appointments are absolutely necessary, which ones can be done using telemedicine, and when we go to appointments, to again be sure to stay 6 feet away from others.
Dr. Wen, thank you so much for the advice, both on a personal and a professional level. We really appreciate it, and I hope you stay healthy and well, and that you and the baby-to-be are doing just great.
Thank you.